I would normally add my own respect for Indigenous custodians. Instead, what I'd like to do is to point you to an interview that Professor Lisa Jackson-Pulver did on ABC Breakfast News this morning, in which she said, "I rejoice in the fact that we've got more Indigenous seniors alive than before and that the population is growing." That's got to be a hallmark for us. If we don't succeed at that, what are we doing? So that's my acknowledgement of custodianship. I'd like to deconstruct the myth of the keynote speaker a little bit. Why do you need me here? I look at this program, I hear the keynote comments from Gerard. He says, I'll give him a hashtag summary of what he said. Isolation hashtag, hashtag loneliness, hashtag availability of opportunities disconnect, hashtag aging well, hashtag invisibility, hashtag $50 note, hashtag instead visibility and value, hashtag co-design. Take those hashtags, you've got pretty much what I'm going to talk to you about today. If my life plan had gone as it was supposed to when I was younger, you'd already know me, because I would have won the 800 metres at the 1980 Olympics, and I'd have won the 1500 metres at the 1984 Olympics. Instead, it was Steve Ovett and Sebastian Coe. And whilst I've rubbed shoulders with those, sometimes literally, sadly, that wasn't meant to be. So I stand before you, close on retirement, a person who was a human movement professional in my younger days, later a public health person, very focused on physical activity at the population level, somebody who's worked in government, non-government, later in the university pretending to be a professor. I decided that my gold medal wasn't going to be in the middle distance running, but rather in prevention. At least I hoped it would be. And in scuba diving. But now, as I stand here as a 9-year cancer survivor who is compromised in his physical activity and challenged in his scuba diving, what I've got is a lot of empathy for older Australians. So I'm kind of living some of the stuff that I'm reading about. So why have you asked me here today? Well, really to give you a big round of applause for what you're doing is the main thing. Let's get started. That's my mission. Other considerations is fantastic. It gives me permission to really wander off topic and do all kinds of stuff. But really what I'll try to do is say, where does it fit in the overall approach, this communication stuff? How do communication strategies promote physical activity? What does best practice look like? Sound like? Feel like? Where are the older people in this picture of best practice? What about disadvantage, vulnerability? How do we apply what we already know? What else? Well, what practical tools and approaches are available? And now what? What can you take away from today, apart from, the hashtags, which I hope you'll use? I've already put mine up there, so feel free to engage with me after today. And you've already been given some homework from Gerard. At the end of this, I'll give you some more homework to take away, I'm sorry. You already know stuff. I'll breeze through this because this is such a sophisticated audience. I'm so jealous of Victoria. You know about the Department of Health's guidelines. They're not as... Pardon me? Thank you. They're 2008. They're not as up-to-date as they might be, but let's let them off the hook a little bit. Mostly they've got it right. World Health Organization, probably a better place to look in terms of what we should be thinking about. I'm not going to drill into all of it. But older adults should do at least 150 minutes, we know that. Vigorous is okay. I'm not sure about the high-intensity interval training for everybody. Not sure I'll be starting there. I personally wouldn't be, in spite of having run 4 marathons and rubbed shoulders with Sebastian Coe. 10-minute duration's fine. 4 additional health benefits: increase moderate intensity to 300 minutes per week or more. We'll come back to this. Enhance balance, prevent falls. We're hearing more about that. Very important. I'm pretty wobbly myself, so balance is pretty important for me. Muscle strengthening, very important. do what your abilities and conditions allow. That's probably my favourite. I'm grappling with that one myself at the moment, doing the best I can. Canada has done another good job, and here's their infographic summary if you'd like. Accumulate at least 150, add muscle and bone strengthening, enhance balance, prevent falls, more physical activity gives better benefits. Let's look at some Australian data. This comes from the Blue Mountains Eye Study, which has given us lots of stuff over the years. And they've looked at physical activity as a determinant of successful aging. What's that? Well, interviewer administered questionnaires, absence of depression, disability, cognitive impairment, respiratory systems, and systemic conditions. So not a bad overall integrated definition. I'd like that one. Big picture. If we took typical recommendations and converted them into Met minutes, they would be 600. Whereas what we're seeing here is a huge benefit from more physical activity. So we're a bit underdone, this would suggest. And this is my prediction for the future, that we'll be saying not just more is good, but it really is good, everybody. And this will help us in terms of, well, how do we get there? Probably not through the programs, but by better emphasis on the environment and design and making it easy, but also all those programs that you all know so much about. So my bet for the future is that we'll see more. More of that physical activity is good. More walking especially is good, because that's the name of the game. I had it as the Holy Trinity, but I thought that gave away my Catholic upbringing, so I've called it the Healthy Trinity. It's 150 minutes at least. It's muscle and bone strengthening. It's balance and falls prevention. We can have a debate about how much or how little, but this is the name of the game. And in there, the best bets, of course, are around the 150 minutes moderate with walking, things that are easy, things that are to do with livability, things that are to do with how we live our lives. What do we know about all of this? We are lucky to have a recent October 2018 survey from the Australian government that talks about older Australians and campaigns that hopefully will improve things. I am encouraged by the way the government is going at the moment. The planets seem to have realigned. They haven't aligned this way since about the year 2000, I don't think. Let's see. We wait and see what Minister Hunt's got for us. And they've looked at 55 plus. I'm certainly well into that stage myself. How active are we? Well, it doesn't really drop off until 75 years, so there is hope. But 5 times a week for females, about 47%, and for males, about 45%. Overall, you know, more than half of older Australians are not getting the benefits that they could. And that's a low bar, really, in terms of, if you think about that Blue Mountain study, how much more benefit? Goodness gracious, we'll all be living so much longer and being such a pain in the arse to everybody if we do a bit more physical activity. I hope we will be, because one of my themes is about the engagement and the activism and the voice of the senior Australian, which is not being heard, it's underdone. We need to not be invisible, like Jared was saying. We need to be really visible in their faces. What do we know? Well, we have science-based physical activity guidelines. There's some evidence that even more physical activity contributes to healthy aging, but we have a lot of work to do to get more senior people more active more often, and we do tend to neglect the strength and balance components. So they're in there. They're difficult to get into practice, aren't they? It's challenging. What do you do about that on a population level? Well, Fitness Australia are here as a partner. They can do some of that, but it's got to be obviously more than that. And probably lots of people in the room have got good ideas about how you do that. So, just looking at my watch, because I know Jen's going to beat me up with time in a minute. Oh, not too long. Yeah, okay. Where does communication fit in the overall approach? Again, I'm just doing a reminder of what's the overall approach. Well, globally, it's the GAPA, the World Health Organization's Global Action Plan on Physical Activity. It talks about 4 policy action areas, of which active societies and active people really does emphasize communication and emphasizes people of all ages. I'm not going to drill into that, you can later. Quite a lot of detail, a lot of evidence behind it, recommendations. Why is it important? Globally, all the member states sign up to things at the World Health Assembly, so Australia puts its hand up and says, yep, that's us too. So the targets of reducing inactivity, promoting activity, we've signed up to those, and we've signed up more or less to the evidence-based recommendations. So that's a good thing, you would think. At the national level, Professor Ben Smith and I co-direct a Australian Systems Approaches to Physical Activity project. Here's a little bit about it. There's some core influences. Here they are: individual psychology, physiology, demographic status, norms. Not a surprise. There are 8 intervention points in the system from what we know so far. They used to be called the 7 best buys, now they're 8 best investment domains. Here's a pinch from New South Wales Physical Activity Strategy in development. So it's being used globally and nationally to inform the way governments think about this. But there's also politics, commercial lobbying, social advocacy going on in the world, and we're foolish to ignore that. And there's governance and knowledge environment and knowledge mobilization. And we might not think that's part of the map, but it really, really is. It's not enough to go to the minister and say, hey, minister, we got the evidence. It has to get across in a different way. Let's put the map together a little bit. There's the core emphasis. There's the intervention points. There's the other components of political and knowledge mobilization. But it's not really like that. It's all interacting all the time. And what I'm saying is, whilst we're talking about communication today, it's just a part of that picture. You don't necessarily have to worry about the rest of the picture. Others should be doing that. So let's all stick to our knitting, but let's be mindful of the other parts of the system that are at play. And perhaps some respect and support, maybe some engagement in that system. We are all citizens as well as people who are promoting physical activity for seniors. You've got votes, you've got a voice. There's different ways of engaging. Shout out to the Heart Foundation. That's part of our context. They've done the best job, really, in the absence of government leadership for years and years. And they brought out the new version of Blueprint for an Active Australia. In the absence of government doing a good evidence-based approach, this really is the blueprint. It's the best practice. It brings it all together, and I commend it to you. And it's online, and it's written by a multitude of professionals, of whom I'm just one. And it does include disadvantaged populations and older people, so it's worthy of a visit. So let's just see some of what they've said. Help older individuals to understand the health benefits of living more, blah, blah, blah. They say mass media campaign. I say it could be narrowcast campaign, could be social media, talk a bit more about that. It's about the disconnect between what's available and what you think is available that we heard from Gerard in his opening remarks. Retrofit environments. Didn't know you were doing that, did you? But we need to encourage that to happen. But also in residential aged care settings, promote activity permissive environments. Very practical things: benches for resting, access for walking aids, low traffic, easy access shops and services. We do it for older people, we do everybody a favour. Shade, safe, aesthetically pleasing, it's livability, it's walkability. We're urban planners, we're rural town planners. We need to be. Social support, a key determinant. So, social and physical activities, important. They improve social well-being, they address the isolation we talked about. Heart Foundation, again, been doing this forever, but it's good medicine. It's good medicine not just for physical activity, but all of the other things. As an older person, you may not come in thinking, oh yes, I really need to get my 300 minutes this week. It might be about fun, it might be about enjoyment, it might be about your mate, who knows what it's, catching up on the gossip about Jenny. If you're in Fitness Australia, then you're thinking about redesigning your offer. The whole of Australia is thinking about this at the moment in sport and recreation. So that's a big thing. England, probably the leading country doing it well. We're trying to catch them up fast. How can we best use existing infrastructure? Are there simple things that we can do to make them more aging friendly? I'll let you read those because they're probably things you're doing or about to do. Telephone support, broad reach, cheap, can reach rural as well as urban. You can configure a skill base more easily, a few people perhaps. Those with less time, they're busy, maybe they're in primary care, they deal with sick people, not well people, or people who want to be more active aging friendly. They're the sort of models that are emerging. And then you can build onto those models because you've got this reference point. It makes assumptions about the speed of the national broadband network. I appreciate that and apologise for that. So, how do communication strategies promote physical activity, you ask? And I say, not in isolation, but by linking to relevant services, opportunities, programs and products. Seems like a glib statement, but you would be amazed how people think by doing the provision of information, the problem is solved, and they neglect the rest of it. You go, yeah. No, seriously, how do communication strategies promote physical activity? And I go, I already told you. It's by linking to relevant programs and services and opportunities and products. It's not just about the communication, damn it. But it's also by using best practice guidelines. What are those? Well, here's one. This is called Flow Proof. This is more about the people who've got a bit of money to spend. Perhaps they're doing mass media-based social marketing, but they will do their formative research. They'll look at their theory. They'll think about the objectives. They'll make sure they've got partnerships to add value in the resources. They'll do process evaluation to make sure that things were implemented as intended. We meant to have all these things happening. Why didn't we get them? Oh, we didn't do that. Oh, sorry. Okay, it was really hot that day. That didn't happen. So-and-so was on sickness leave, etc., etc. No problem. We just need to know, is it because of implementation failure or did we get the whole thing wrong? We run what we do. Here we're talking TARPs because it's about mass media, but it's really about intensity of intervention. Typically, over the decades, we have underestimated, we've got optimism bias about what does what. Turns out it takes more effort for a longer time to get those results. Changing behaviour is hard. Sustaining behaviour change is hard. It's often more about the environments that, out of cognitive engagement, support what we're doing. They make that activity easier. Yes, the cognitive engagement is nice and it might delay our dementia a bit, but actually if the environment is walkable, that's half the battle. We need on-the-ground support services. We need outcome evaluation, not least because that's what sustains the programs. This works, Minister, why would you be defunding that? There'll be an outcry. So evaluation got its own purpose beyond it's a good thing to do. If we've proven it, we don't need to keep doing it. We need to make sure that we're delivering what is good, specification, as it were. For example, in general practice, the GPs don't need to do research to prove that if they give advice about smoking, that works. We need to get them giving that advice, right? We need financial and summative evaluation, and we haven't done a good job on that. So that's called Flow Proof, and I'm going to focus on-the-ground support because I think that's the name of the game for the audience today. So it's infrastructure, services, public relations, and media, all of the above. You don't have to have a multi-million-dollar budget to be able to deliver this stuff. Let's think about that a bit more. Integrated and system-wide is a key. Consistent messaging. Think about the theory if you can. Measurable. Linkage to broader strategies. It's not just about physical activity. It's not just about falls prevention. It might be about fun. It might be about connection. Duration and investment. It doesn't happen in 1 year or 2 years or 3 years, really. It's more like 5 years or 10 years. So we've got to live a bit longer to enjoy it. We need a planning and evaluation protocol. We've got some examples to use. And hopefully we'll make those publicly available. Government departments typically shy about sharing what the budget was for the campaign, but we've unpicked that a little bit in Australia in another piece of work. Bottom line is, compared to what we should be spending, we very, very rarely meet that threshold. Questions then arise about, is that the best spend of that money? If you're going to do mass media, big scale, hit this threshold or don't bother, some might say. You've got to keep going. We've all got to keep going. That's fine for, the big bucks, the big mass media. We've done some work recently, so I'm going to show you stuff that's not yet published, where we've looked at low resource environments. Suppose you don't have the big bucks. Suppose you've got to do it on a shoestring. What can we learn from that? What can we say about that you can take away with your smaller budgets than 10 million a year? And we've called it pragmatism versus perfection. We've got 10 practice steps. It's about aims and audience, so they go in alphabetical order and numerically 1 to 10, just to be helpful. Think about your aims and your audience, ask those questions, build your messages. If you can't afford your focus groups, let's use the ones and the messages that have already been provided by the Australian government or somebody else. Maybe you have got time to do those focus groups, or maybe you're using your online surveys to give you some insights. Get those insights somewhere. Choose your channels, develop your partnerships, enhance the campaign product. Okay? Don't just do messaging, have services, products, deliverables, lots of people in this space. Find resources or free, very low-cost resources. When you're on a shoestring, you've got to be really snappy about getting everything you can. Work with the university. They may have a PhD student, or somebody may regard a publication opportunity as the equivalent of payment. We're often saying that, it's a pity you haven't got the $50,000 we'd like for that piece of work, but if we get a publication out of it, that's nearly as good, I paraphrase. Generate publicity. Heighten the highs, so that's about feeding back into what you're doing and amplifying the things that are working well. Invent fresh content. Older people get bored as well with the same message. Join forces, that's about, again, linking with other strategic efforts. Lots of stuff around the environment, livability, planning approaches, shade cover. They're just multiple. I was in a meeting on Monday in the New South Wales Premier's Department. Sadly, we were letting go of childhood obesity as a Premier's priority, but yet embracing things around tree cover, active streets, connectedness. So in a way, we were coming at it in a more integrated way. Still a lot of energy in the room, still a lot of interest. Join forces. If you can, move to flow-proof. Persuade the government to do best practice, not 1-year campaigns, not 2-year campaigns, 10-year campaigns with different efforts. How are we doing? Good. Okay, what about culturally and linguistically diverse communities? I'm just going to refer to the fact that the government has done a bit of work here. This is really what Gerard told you in his opening remarks. There's a disconnect between what's available and what we perceive as available. That's an easy fix, really, isn't it? Low-hanging fruit. Promote inclusiveness. Raise awareness of what these clubs or programs or opportunities are. What can you do? How do you join? It sounds really, really basic, but in reading this, I was working with a research assistant a couple of days ago. Her background is, she's very bright, comes from Indonesia. And I remembered this message and I said, well, maybe there's an opportunity for you in the future to work here. We're a group of 30, but we're very diverse and we're very inclusive. There's all kinds of nationalities on this floor. It's a friendly place to be. You could tell by the body language that that message resonated. So we can underestimate how powerful these things are. Develop products and services that take into account cultural sensitivities and needs. How do you do that? You ask them. You listen to them. You use their networks more than yours. You find their leaders, their logic, their DNA, how they operate, their systems. Learn. Seek first to understand, then to be understood. If we do this, then we're a trusted source. If we don't, we're not. We're just these outside dudes. It's too hard. It's not for me. Okay, so what does it look like? Well, I'm more going to point you at these documents than drill into them. Jeff French is one of the world leaders in this space. He's led the development of 2 products that are useful. This is one, and he talks about 5 intervention types. And this is another, which is about social media. And social media is a key if you're thinking about your budget on a shoestring. Because social media is relatively cheap. We don't truly know yet if it can do the job on its own, but maybe it can, if it's done well. And he talks about the benefits and 5 stages of development. But there's a whole book there. It's a separate day, really. So I'll just point you at that good practice. And he talks about types of social media and the uses thereof. And he says, there's the infographic. How to use infographics. So another message is get across this. Increasingly, infographics is where we're going in communication, more and more and more. It's visual, it's the 2-minute video, it's the 1-page infographic, and that's true for older people as it is for anybody else. And he talks about the social marketing triangle. At the center of that is the citizen. That's where I want to go next. This is the voice of the empowered senior. Votes. Sometimes it's literally votes. Other times it's ways of making the invisible people we heard about in Gerard's introduction visible, beyond waving the $50 note. How else can you do it? Lots of ways. You're already doing it in many ways. But I'm suggesting this is a strategy that's underdone. One example is our Shared Outdoors citizen science project. Dr. Yvonne Laird has just joined us at the University of Sydney. So everywhere I go, I'm dropping the idea with government and others that this is good stuff. It connects up the new Premier's priorities. When the Premier says, we want to put the citizen at the heart of things, this is how you do it, Premier. We'll give you the solutions. It's a bit advocacy-ish, so you might like it parked out in an NGO rather than in, Governor Macquarie Tower, where the Cabinet Office might meet. But it's good stuff. Different maturity of government. Some of them take well to advocacy from an NGO, helping them do what they'd like to do. Others feel threatened by it. You'll know your own local government and your government as to their level of maturity and their ability to deal with advocacy messages. We're getting into the home straight. How are we doing? So what can I take back from today? What can I do next? And here comes the dreaded homework for you. Here's some 7 thoughts. Continue the conversation that you started. If you're not on Twitter, my God, why not? Come on. What's the matter with you? Get on there. Hashtag VAAP. There'll be lots of chatter on Twitter about this, sharing of information. Revisit the presentations and all the references from today. It's absolutely such good stuff. Really, you have a treasure trove of presentations and information today. It's the best I've seen to focus on this issue. Hats off to the organisers and all of the other presenters. Just, well done. In particular, revisit the concepts of best practice in social marketing and social media if you're zooming in on the communication. Remember PRAGMATIC, the 10 steps on a shoestring. So social media is really, really important if you're working with low budgets, but we have some thoughts about how to do that better. If you turn out and evaluate it, then you will really add to the knowledge, because we just don't know if it's standalone social media does the job yet. Some hints that it has to work alongside mainstream media, but that hypothesis is being tested every month. Ask yourself, should I be listening more rather than communicating more? I mean, it's a two-way communication thing. My sense is we tell more than we listen. Seek first to understand these communities, these people, then to be understood. The co-production message that started the conference is a powerful one. I endorse it wholeheartedly. And think about the voice of the empowered senior. That gets votes in all kinds of ways. What about your own voice? Be an empowered citizen. This is political, whether we like it or not, Like many of you, I've been in a position of giving governments the best advice, the best evidence. That's not enough. If we have a whole load of cranky older people saying they want this walkway improved, they want better shade and lighting, that's more powerful. It's more powerful than a Cochrane review I might show to the minister's advisors, that's for sure. You can also ask me things on email, especially over the next 2 weeks. I've given an undertaking to be, phone a friend, email a friend. You can follow me on Twitter if you're bored. And you can check out the Slack platform that we've just originated this morning. You may already have one, I'm not sure. I'll have a chat with Jen. But Slack is kind of its own community. Some of you will be aware of it. It's a focused set of conversations where you can share information and messages and complaints about the keynote speaker. Thank you very much.